Tremor means involuntary shaking movements, usually hands, but other body parts also possible. It can be caused by very serious or very benign processes, and we will discuss most important ones. Most common cause is physiological tremor. It's responsible on 50% of cases. If person is nervous or anxious and he or she has shaking of hands or tremor, it's usually physiological tremor. If person have not eat and he or she has hypoglycemia and he has tremor, it's usually physiological tremor. If person drinks coffee and drinks energetics, it's usually physiological tremor. Physiological tremor is more pronounced during fine motor movements. For example, writing, drawing, or painting, or such movements where there is fine motor skills. It's physiological tremor. Physiological tremor is fully reversible. And nicotine or smoking, caffeine, stress, hypoglycemia, also alcohol, and some people second day of alcohol have important tremor. It's physiological tremor also. And this tremor usually bilateral or affects both hands and more pronounced during fine movements. Second important cause of tremor is essential tremor. Essential tremor accounts 20% of cases. Essential tremor, also known as action tremor, it occurs usually after 60. After 60, it affects around 20% of older population. And if you ask such person to draw spiral, and if he draws like this, it's okay, it's normal. But if he or she draws like this, it's essential tremor. Essential tremor is also more pronounced during physical activity, like drawing or dialing number or eating or writing. This tremor is exacerbated by movement. What is treatment? Treatment is environmental factors like reduced caffeine intake, improved sleep. Beta blockers are first line treatment like propranolol, and second line treatment is gabapentin. The prognosis of essential tremor is generally good. It does not affect person's lifespan, but it affects person's quality of life. That's why it's important to treat if it occurs. But usually it's benign. It can be progressive over time, but usually it has benign course. And most important cause of tremor is Parkinson's disease. And when we say tremor, usually we subconsciously meaning Parkinson's disease. Why it happens? It happens because Parkinson's disease directly affects our lifespan. Person with diagnosed by Parkinson's disease live around 10 years after diagnosis. It directly affects person's lifespan. That's why it's important. It usually occurs after 65. It affects around 1% of population after 65. So most important risk factor for Parkinson's disease is age. Second important risk factor is male sex, because it's more common among males. Also head trauma can be risk factor, pesticides, heavy metal poisoning. There is such small risk factors, but their effect is not very pronounced. But for example, Muhammad Ali is boxer world champion and maybe best boxer all time, and he had Parkinson's disease, and it's considered that his Parkinson's disease is caused by multiple head trauma. What is characteristic for Parkinson's disease? It's resting tremor. So person has tremor during resting, not during movement, but during resting. And if you remind essential tremor, in case of essential tremor, we have tremor during action, during movement. But in case of Parkinson, we have resting tremor, and pill rolling appearance like this. Maybe you can see the older person has tremor like this. It's sign of Parkinson's disease. It's resting tremor. Also, in case of Parkinson's disease, we have other symptoms also, while in case of essential tremors we have no other symptoms, and other symptoms are bradykinesia, slowed movements, muscle rigidity or muscle spasticity, and postural instability. It's Parkinson's disease. If person has postural instability and muscle rigidity and slow movement and tremor, it's Parkinson's disease. Parkinson's disease affects 1% people over 60. And what's treatment? We have no treatment, we have no cure, but we can manage symptoms, we can decrease symptoms, and levodopa and carbidopa is used, and dopamine agonists also. But prognosis, as I told you, is around 10 years after diagnosis. And medication is important also, because some medication can cause tremor. It's responsible around 8% of cases, sometimes more, sometimes less. It depends personal risk. For example, if person drinks medication, higher risk. If he or she is generally healthy and don't intake any medication, lower the risk. Common medications like salbutamol is asthma medication, can cause tremor. Antidepressants, stimulants, caffeine, nicotine, also stimulants, so they can also cause tremor. And rare cases is multiple sclerosis and hyperthyroidism. In case of multiple sclerosis and hyperthyroidism, tremor is not leading symptom, so it's secondary symptom. That's why we pay less attention, because when patient comes, patient says different symptoms first. For example, tachycardia or palpitations or weight loss or sweating in case of hyperthyroidism, and then maybe he or she said that also tremor, but it's secondary symptom, not primary symptoms. Same in case of multiple sclerosis. Multiple sclerosis is not common disease, it's very rare disease, usually diagnosed after 20 to 50 years of window. And fatigue, walking difficulties, numbness, tingling, spasticity, vision problems. It can have variety of symptoms, and one of these symptoms can be also tremor. That's all I wanted to say. Now let's summarize. In case of tremor, most common cause is physiological tremor. If person is anxious or drinking coffee or have not eaten, it's physiological tremor. If person is more aged and he has tremor during movement, it's essential tremor. And if person has resting tremor, it's Parkinson's disease, usually after 60 or after 65. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.